Knock, knock. Wash my hands. I'm gonna do a quick Q-sin. No trach, no abdominal tubes, no chest tubes, no oxygen right now. No clutter in any pathways. Bed is in the lowest position and side rails are up. Hi, Miss Baker. My name is Sarah. I'm gonna be your nurse today. How are you? Good. So I see that you've come here with some belly pain. Is that right? Okay. So I'm gonna go ahead get your vital signs real quick. Okay. So blood pressure. Okay. Pulse ox right on your finger. And go ahead and under your tongue temperature. There you go. Good. And go ahead and just breathe nice and normal. I'm gonna count your respirations. Okay, good. So blood pressure is 120/80, heart rate is 84, respiratory rate is 18, oxygen 99% on room air, 98.6 temperature, and your pain is a 9 out of 10. Okay. And where does it hurt? Good, okay. Do you know where you're at right now? Good. And what's your name? Miss Baker. Miss Baker. Yep, good job. And what year is it? 23. Yep, good. Alright, so go ahead and look at me and smile. Good. Face is nice and symmetrical. Go ahead and I'm going to look with a pen in your eye. Good. Pupils dilate. They're nice, equal, and round. Go ahead and turn your head that way. There you go. No JVD present. And turn your head the other way. Good. No JVD present on that side. Very good. Go ahead and sit up for me. Okay, I'm going to listen to you. Okay. Good. S1 and S2, no murmurs. I'm going to go ahead and listen to your lungs. Good. Big breath. Good. Go ahead and lift up this arm.
I'm not gonna rise up.
Good. Good. Lung sounds are clear bilaterally. Go ahead and sit up for me again. And take a big, deep breath. Good. Chest is nice and even. Rise and fall. Go ahead and lay back down. Get comfy. Okay. Can I look at your belly? Okay. So no visible distension here. I'm going to go ahead and listen to it. Alright, hyperactive bowel sounds in all 4 quadrants. I'm going to go ahead and touch it. Tell me if it feels... I love you too. Tell me if you feel any pain, okay? So it's going to hurt over here, okay? Good? Or I'm sorry, I was going to hurt over here. Does that hurt? Okay. Any tenderness here? Okay. About here? No? Okay. Alright, so tender to touch in the right upper quadrant. Okay. And then go ahead and grab my fingers, squeeze, and then pull. Good, and then push. Good, nice and equal strength. Look at your fingers. Good. Which finger am I touching? Good. Which finger am I touching? Good. Skin is warm and dry and normal color for ethnicity. Normal skin turgor. No swelling in your legs. Are you having any pain, tingling, or numbness in your feet or your hands? No. No, okay. Check your toes. Good. Which toe am I touching? Good. Which toe am I touching?
Thumb toe?
Yep, big toe, yeah. Alright, so I'm going to wash my hands. Okay, so as I'm finishing up my assessment, your belly is starting to hurt. So, act like your belly hurts. Like you need to throw up. Okay. Oh no, your belly hurts. Here's a little bowl if you need to throw up. So go ahead and sit up and act like you're throwing up. All right, here I'll take that from you. Okay, so it looks like there's 300 milliliters of ground coffee emesis. I'm gonna go ahead and get a hold of the doctor. You go ahead and stay right there. Here's your call light. Okay, if you need something, don't hesitate to call. I'm gonna step out, call the doctor, and I'll come back in. Okay? All right. Okay, so the doctor, wash my hands. The doctor did order Zofran, 4 milligrams IV every 6 hours. So what that Zofran does is going to calm your belly down. So you're going to feel a little bit better, feel like you're not going to need to, the need to vomit, okay? So I'm going to go ahead and get that stuff ready. Do you have any questions? No? Okay, good. Alright, so you hang tight. I'm going to gather my supplies. In a little bit. Okay. So we're going to regroup. Okay. You magically have an IV saline lock in your left anacube. So I have Zofran here. I am going to wash my hands. Going to check what the orders are against what I have. And this is Zofran 2 milligrams per milliliter, and there are 4 milligrams ordered, so it'll be 2 milliliters. I'm going to wash my hands, grab my alcohol swab, clean the top off. Can you give me your name and birth date?
Mrs. Baker.
And you're 54? Good, okay. So right person, right dose, right time. And I am going to put gloves on. I'm going to withdraw 2 milliliters of air. Inject it. And draw out 2 milliliters of Zofran. I'm going to access saline lock. I'm going to push it over 2 minutes, noting any burning, swelling, redness, irritation, pain. Are you having any pain right now with your IV? Okay, good. Okay, so 2 minutes has elapsed. I would flush that with saline beforehand also. So then I'm going to grab my saline flush to flush. So I'll just pretend. It is, it's just water.
Yeah, is it good? I can't do
It would if I pushed it. I'm going to pretend. Alright, good. IV's nice and patent still. Put the cap back on. Okay, I'm going to check some orders that I have here. Okay, so the doctor wants a stool sample. We're going to check for blood in your stool. And then we're going to draw some labs. And then we're also going to insert an NG tube. And that's a nasogastric tube. And it goes in through your nose, down the back of your throat, and into your belly. And it's to help with all of that yucky stuff that's in your belly right now, okay? So, I'm going to go ahead and have lab come in and draw your labs, and then we'll insert your NG tube, okay? Sound good? Okay.
Mom, it's taking forever.
I know. Hold on. Alright, come back in. Wash my hands. Alright, so your NG tube is in. And it's hooked up to low intermittent suction from the wall. I see that the STNA notified me that your blood pressure has dropped quite a bit. And the canister is over halfway full of blood. So, I'm going to reassess your belly. Okay, I'm going to wash my hands. Okay. No, it doesn't look any different right now. But you look ill and pretty drowsy. Okay, let me listen to your heart. Okay, your heart rate is increased to 122. We are going to check your blood count that came back. Okay, and it looks like your CBC came back. Your hemoglobin is 10 and your hematocrit is 31%. So we're going to go ahead. I see an order for 2 units of blood. So we're going to go ahead and give you 2 units of packed red blood cells. Okay. So have you ever had a blood transfusion before? No. Okay. All right. So we're going to go ahead and get you hooked up. Okay. And then hopefully you're going to start feeling better. Okay.
Mom,
All right.
Mom, my knee hurts. Right here.
All right. Okay, I forgot to report off, so I'm going to report off to the nurse right here. This is Miss Baker. She came in a couple days ago with some belly pain, and her vital signs were pretty good. She ended up having a GI bleed that they fixed in endo, and she prior to that got 2 units of packed red blood cells. She became diaphoretic, and her heart was up to 122, drowsy, pale, blood pressure dropped. So they took her to endo, repaired some bleeds, cauterized some bleeds. She had an arterial bleed that they also fixed while they were in there. She is now recovering well in her room, expected to be discharged. She does have a standing order for Zofran, 4 milligram IV every 6 hours as needed. And she's tolerated that well. I did notify her that if she gets any headache, dry mouth, fatigue, constipation, or diarrhea, that is common side effects for that medication, and that we will be monitoring her heart rate closely while she's on that as well.